Hi everyone, I am here to talk to you about deep vein thrombosis. My name is Kelly Hams. Uh, Deep vein thrombosis. We're going to learn about what deep vein thrombosis is, or as I'm going to refer it as in the slideshow is DVT. Some symptoms, what can cause DVT, some risk factors, when to go and see a doctor, and some treatment and medications. Deep vein thrombosis is thrombosis in a vein lying deep below the skin, especially in the legs. It can cause a clump of blood cells that are called the clots. DVT can lead to major health problems, and in some cases can be fatal. DVT can cause leg pain or swelling, but also can occur without any symptoms. Some of the symptoms are swelling, gradual onset of pain, redness, warmth to touch, worsened leg pain when bending the foot, leg cramps, especially at night and often start in the calf, blushing or whitish discoloration of the skin. And when should you go and see a doctor? When you start to get some shortness of breath, some chest pain or discomfort that worsens when you take really deep breaths or when you cough, feeling lightheaded or dizzy, some rapid pulses, start coughing up some blood, and if you start to get edema. And normally with deep vein thrombosis, you're only gonna get edema in one leg and not the other. So here's a picture of our veins, and then on the right side of this is going to show how red it is on the outside and how swollen it is. This sometimes can be overlooked for cellulitis, but that's why when you start to see these signs and symptoms, you have to get in and go see your doctor right away. Here also is a blood clot in one of your veins, and as we've learned, blood clots are not good. They can easily be fixed, or they do sometimes fix themselves, but they also can be very, very, very dangerous. This one is a picture of what edema looks like on the left side where it says it's swelling. You can see that the one leg is much larger than the other leg. This is not normal and should also be looked at right away. And the other one is showing you some discoloration of the skin, how this rash has formed, but it's only in a certain area. And this is just another picture that I found about showing you the normal way that the blood flows through the vein and how deep vein thrombosis, you can see how it's starting to clot, and then the clots start to detach and head up towards the heart. What causes DVT? A cause of DVT includes damage to the inside of blood vessels due to trauma or other conditions, changes in normal blood flow, or a rare state in which the blood is more likely than usual to clot. Some risks: prolonged sitting or immobility, recent surgery, which is a big one, recent trauma to your lower body, obesity, heart attack or heart failure, pregnancy and recent childbirth, high altitudes, which we all learned can be very, very harmful too. Estrogen therapy or birth control pills, which are going to be changing with your hormones. Cancer, rare genetic conditions that affect blood clotting factors, certain heart or respiratory conditions, advanced age, medical conditions that can affect the veins. Some complications of DVT. Pulmonary embolism. This occurs when vessels in your lungs become blocked by a blood clot that travels to your lungs from other parts of your body. Usually it comes from your leg, and this can be very life-threatening. The signs are a lot of the same as DVT. You have the sudden onset of short breath, chest pain, discomfort, you're going to cough, you're going to feel lightheaded, dizzy, or you might faint. Your pulse is going to be very, very fast, and coughing. And if you start coughing up blood, so these two are like hand in hand, and sometimes it can be misdiagnosed. Some treatments. When you go to the doctor is going to diagnose you the condition by using these various types of sonograms: Doppler ultrasound, a venograph, an independent pathologograph, and a CT scan. You can get some anticoagulants or blood thinner medication, as most people know it as. In rare cases, large deep vein thrombosis of the leg is treated with surgery. And most of the time it's because the patient can't take blood thinners. Here are some of the medications. This is just like a heparin shot. Yeah, you normally get this right after a major surgery, or you may possibly get it because the oral medication is not working. You get this shot once a day. Most people take it in the morning, and it is very, very effective, but it is a fast solution. Some oral medications, some of these they all do the same thing. Warfarin or Coumadin is the major one that most people are familiar with, but all of these do pretty much the same thing. And here are my references. This one I got, the first one is Blood Clot in the Leg, Deep Vein Thrombosis by a medical author, and a couple doctors on here. This is a very, very good reference for this assignment. Then of course I also got some stuff from the Mayo Clinic. The pictures are from the Mayo Clinic, and these two pretty much went hand in hand with the same information. I hope that you guys have enjoyed this. You have learned something, that it was educational, and everybody have a good night.